We have 3 speakers for this webinar. The first is Erica Belanger, is an advocacy officer at IPPF. She has over 8 years experience advocating for increased financial support for sexual reproductive health and rights. We also have Sibylle Koenig, as an independent consultant. She also has a decade of experience in managing, monitoring, evaluation, international aid programs and grants, mainly in global health, civil society, good governance, and gender equality. And last but certainly not least, we have Karen Hoehn, who is an independent consultant, and she spent the last 28 years helping nonprofits and companies improve health and reduce poverty by developing programs and systems and influencing public policy, and also having mobilized over $1 billion in resources for those activities.
The first slide you see in front of you there is the outline for the webinar, the outline for the presentation that we're making today. John has already provided some introduction to the Innovation Fund projects. We'll provide a little bit more detail about that. We're going to explain why 2015 has been a big year for the topics around financing for development. And then the major part of the presentation is focused on the findings from the 2 projects. What are the trends for development assistance and reproductive health supplies and sexual reproductive health rights financing? What are some advocacy messages that have come from the research? And more specifically, how are some ways that you can engage advocacy events on financing for development and on the Global Financing Facility as a manifestation of the changes that are taking place? Slide. Next slide, please. Thank you. Erica, do you want to talk a little bit about the IPPF project?
Great, thank you, and welcome to everyone on the call. So as John stated, this webinar has been made possible through the support of 2 RHSC Innovation Fund grants. Currently, IPPF is implementing the National Action for Financing, which is a project that works with global and national stakeholders to position funding for reproductive health supplies as a critical element in the new development financing architecture. As part of the project, we've developed a number of user-friendly tools to increase advocates' awareness and identify entry points into the various discussions on the changing aid architecture, and all of these materials are available on IPPF's website under Development Resources, so I welcome you to have a look. And as John had mentioned, this project builds on the independent research as an evidence base to our advocacy. And Karen will explain a little bit more about the work that's been done under that grant.
So the Innovation Fund decision makers were quite foresighted, I think, in looking at the need for research on what are the financing for development trends, and they provided a small grant for intensive research during March and April this year to look at what are the overall financing for development themes being discussed in the run-up to the July 15th Addis Ababa International Conference with heads of state. What are the major themes being discussed? What's the evidence and research around trends in financing for development? What decisions were going to be made in Addis Ababa in July? And how does that intersect with financing for reproductive health supplies and sexual reproductive health rights? What ways do these themes and these financing for development trends affect financing for SRHR and reproductive health supplies? That formed the basis for many of the messages that have now been improved and refined through the IPPF grant, and we're now taking forward and will present. Okay, next slide, please. Oh, and by the way, just to mention that in terms of the RHSC original research, it has extensive documentation on the findings and the data sources, and more than most normal human beings would ever want to get into. But if you really want to, you can track down most of the original source materials and evidence basis for all of the findings in that document, which is available on the RHSC website. If you want the more simple, user-friendly version, it's really best to work with the IPPF project's Financing Demystified publication, which is much more user-friendly for normal humans who aren't specialists in these issues. Okay, when it comes to why is 2015 a big year for financing for development as a discussion. You've probably heard buzz around this quite a bit this year. This year in July in Addis Ababa, there was the first International Financing for Development Conference since 2008. That is the first international conference which heads of state and major decision makers got together and made some agreements about how they were going to prioritize financing for development for the years to come. It's the Addis Ababa Action Agenda, which resulted from this work, is really concretizes a whole series of trends that have been underway for a number of years and are reflected in the analyses and analytical reports that you can find from an intergovernmental consultation that took place in the whole year leading up to the Addis Ababa conference. The Addis Ababa conference addresses a wide range of topics. Oh, okay. The conference, the Addis Ababa Action Agenda addressed a wide range of topics. And while in theory, anytime money flows, it can affect access to sexual reproductive health information, services, and supplies. It can affect access to reproductive health supplies, whether it's government resources that are available, whether it's equity or capital that's available to companies for expanding contraception distribution, whether it's local government funding, whether it's the funding that's available in people's pockets to buy reproductive health supplies. Anytime money flows, it can affect these, where the resources are coming from and going to. Having said that, the Addis Ababa Action Agenda addresses a lot of topics where the link is much closer than in others. So as you see this list here of the major topics addressed in the AAAA. There's domestic public resources, which are domestic developing country government resources. There's domestic and international private business and financing flows. There's international development cooperation, which is mostly grant assistance from donor governments to developing countries. There's international trade as a major topic, debt. The systemic issues are issues around reducing corruption, reducing tax evasion, reducing money transfers internationally that are illicit, a whole variety of rather abstract, really essential and fundamental to the functioning of the international financial flows and the international financial system as a whole, but a bit distantly removed from reproductive health supplies specifically. And the last two sections, one, science, technology, innovation, and capacity building, obviously has some implications for innovation in reproductive health supplies and SRHR. And the last section, data monitoring and follow-up, also has some pretty direct implications there. Next slide, please. When trying to figure out how financing trends in general would affect financing for reproductive health supplies, we first had to figure out where is financing coming from and going to now in relation to reproductive health supplies. And that was very difficult and quite intensive because while there are many individual specifically designed studies for specific purposes by, for example, the Clinton Health Access Initiative, the Kaiser Family Foundation, Track 20, PMA 2020, OECD DAC data collection. Very few of them, they all are little pieces of the picture and they don't match up and align perfectly and they can't create a whole picture. The best whole picture for financing that you can get within the field of sexual reproductive health rights has been the analyses that have been done every year for about 20 years by the Netherlands Demographic Institute, funded by UNFPA and published jointly, which is where the data for this pie chart comes from. What those studies do, what the NEVI studies have done, is they have looked at the costed package of the Program of Action of the International Conference on Population and Development and tried to look at where the resources were coming from in support of the package of services in the ICPD costed package. And as you can see from this pie chart, the NEDI findings indicate that consumers in developing countries provide by far the largest share of financing for the sexual reproductive health information services and supplies, the family planning, the reproductive health supplies that are included within the ICPD costed package. And that's what this light blue, this very large light blue slice of the pie is. Now that figure may be an overestimate. The figure is a bit controversial. In fact, we're double checking some of the assumptions behind that figure now. But nonetheless, even if the figure is a little high, the basic finding that consumers in developing countries provide most of financing for ICPD program of action out of their own pocket is pretty non-controversial, that they provide the largest single chunk of financing for ICPD. The next largest chunk you see over there on the left, oops, is the gray slide, and that is developing country government spending for ICPD, and the third largest chunk is from donor country governments, as you can see with the dark blue shaded pie wedge near the top. Okay, next slide. When it comes to development financing trends overall, the Intergovernmental Committee found really divided things out into 5 major categories. And in all of these categories, they found that funding flows, financial volumes are increasing. The categories are domestic public spending, which is domestic developing country government spending for development. There's domestic private spending, and private includes nonprofit, for-profit, charitable activities, private out-of-pocket. Any private spending for development finance are included in that figure. International public development financing has been going up, and that is mainly donor funding for development finance, donor government funding. So it's international governments giving money internationally to support development finance. International private financing, financial flows for development also are increasing, and that definition includes international companies and corporations. It includes international NGOs and nonprofits. It includes private international foundations, a whole variety of non-governmental entities. And then the last category here, blended public-private, that's a mixture of grant and non-grant, government and non-government funding consolidated in different programs. They also found that financing was going up as well. Now, as I mentioned before, it's very difficult to know for reproductive health supplies specifically, and it's also difficult to know for ICPD as a whole, for sexual reproductive health rights as a whole, what the trends are in each of these categories because of the gaps in the information. But a reasonable, informed guess would indicate that basically the trends in reproductive health supplies, in sexual reproductive health rights, information services and supplies, more or less seem to mirror what's going on in development finance as a whole. There are caveats to any of these because the data is not perfect. For example, when it comes to domestic developing country spending for reproductive health supplies, it's not clear how much of that is domestic developing country government own source funding or how much of that is donor driven. That's not clear. But as a whole, it's reasonable based on the evidence to infer that the trends mirror what's going on in development finance as a whole. Next slide, please. So now I'm going to tell you about the advocacy messages that came out of the research and the major trends being discussed. These are the places where we could see an intersection between the overall financing trend, the commitments being made by governments and heads of state in the Addis Ababa Action Agenda, where those intersect with what we know about reproductive health supplies and SRH financing. There are 10 of these messages, and I'm going to go through each one. The first one is that more aid is needed, especially in least developed countries and low-income countries. Most governments have made a commitment to increase their expenditure for development cooperation through classic grant aid, through development aid. Donor governments, most of them committed in Monterey in 2002 to meet certain targets. Very few of them have. And there was a commitment, reaffirming of this commitment in the AAAA, that governments will honor their commitments to increase aid. This is clearly an opportunity because if development aid is increasing, that provides an opportunity to increase development aid for reproductive health supplies. It also creates a challenge because there's competition with new ODA sectors, for example, climate and security, which are being included within ODA in some respects now. And so in order for civil society to be able to hold governments accountable for their commitments, they must create time-bound implementation schedules to honor their financial commitments and fulfill health rights. I've mentioned the donor government commitments. When it comes to developing country commitments, there are quite a few commitments that developing countries have made in terms of their commitment to financing the ICP Program of Action. There's to health, there's the Abuja Declaration, which most African governments signed on to, indicating specific financial targets. So this advocacy message applies to all governments that have made commitments to increase their funding for health rights, that they need to create clear implementation schedules that civil society can monitor in terms of their honoring those commitments. Next slide. Advocacy message 2. Transparency is required. There's a major trend towards increasing financing for development in new ways, in innovative ways, in blended financing ways that blend public and private, and grant and non-grant mechanisms. Many donor governments, for example, are increasing their investment in commercial and market-like activities oriented towards development finance. And many of these are quite complex and very difficult to understand. There are usually quite few decision makers involved in how those are being implemented. So this advocacy message is that public funds that are used to leverage private capital must require clear assessment criteria, independent evaluation, and transparent data access so that civil society can monitor whether those public government funds that come from taxpayer pockets are being used in a cost-effective manner for poverty reduction and for improving sexual reproductive health rights and for ensuring that donors honor their commitments to those rights. Next slide. The third advocacy message is be careful with loans. It's clear in the trends as a whole that many governments are turning to loans as a way of increasing the volume of resources for development finance. This is a very clear trend in many, many ways. The trick with loans when it comes to reproductive health supplies and SRH is that many reproductive health supplies are recurrent costs. They're technically in accounting terms called current costs, but they are costs that recur regularly. And for these types of costs, for example, contraception needs to be purchased on a regular basis throughout the year and year on year for many types of contraception. Generally, as a general rule, loans are not the best way to finance such recurrent costs, because what it means is that you're having to pay back the price of the loan plus the interest and all the fees at the same time that you're having to buy the next year's round of supplies. So it basically increases over time, continues to increase the cost of those supplies. There are some circumstances in which loans and debt financing are appropriate for SRH and reproductive health supplies. These are fairly narrow. The Pledge Guarantee for Health has done a nice job of showing how using loans to bridge a gap between the end of a donor grant for supplies and the fulfillment of a commitment that has been made for future funding for supplies, how a bridge loan can be very helpful. So under very narrowly defined and clearly spelled out circumstances, loans can be an appropriate mechanism to use for SRH financing development cooperation. But most of the time, there are very high risks associated with that. So this advocacy message says that governments must exercise caution in using loans and debt financing, and creditors are obligated, they must provide consistent, transparent, and verifiable information about how they're making decisions, what criteria they're using to make decisions about whether or not to issue a loan, how the loan disbursements are taking place and on what criteria, and what the impact is overall. Next slide. Advocacy Message 4 focuses on the ICPD Program of Action. Many of the decision makers involved with development finance come from finance backgrounds, especially as these new non-grant financing mechanisms increase in volume. They don't necessarily come from a development cooperation background. They don't necessarily come from a health background, and very few of them, it's safe to say, come from an SRH or reproductive health supplies background. Both the SDGs reaffirmed the ICPD as essential to sustainable development, and the AAAA, the Addis Ababa Action Agenda, emphasized supporting the implementation of quote-unquote relevant strategies and programs of action in sustainable development. So the opportunity there is to, urge the governments that have signed on to the SDGs and signed on to the AAAA, that they honor commitments that were originally made a very long time ago and ensure full funding of the International Conference on Population and Development Program of Action, because it's essential to achieve sustainable development. The challenge is that most of the decision makers don't really know much about ICPD, may never have heard of it, and so their awareness needs, the links between ICPD, between SRH rights and sustainable development need to be made crystal clear for them and made very clear. Next slide. Advocacy Message 5 piggybacks very nicely on this. And this advocacy message is to reiterate sexual reproductive health rights is essential to sustainable development. In the Addis Ababa Action Agenda, governments around the world made a commitment to a new social compact to ensure universal access to national social protection systems for all. They were quite explicit about this. Those packages, these national social protection systems, will be defined at the national level and will be defined within the cultural context and the decision-making context of each developing country, or putatively all countries. The opportunity there, of course, is that if reproductive health supplies and sexual and reproductive health information services and supplies can be included in those national social protection systems, if they can be defined as essential public services, then access should dramatically expand, even to especially impoverished and marginalized populations. That's the opportunity. The challenge is that as the national governments are defining their national social protection system, we have to make sure that these services, information, and supplies get included in the definitions of essential public service and essential public good. Next. Advocacy Message 6, be careful with tax increases. Not to belabor this point, but the Addis Ababa Action Agenda puts a lot of emphasis on the importance for developing country governments to increase their domestic revenue collection. And the challenges, and it goes into great detail about the challenges that have been in place that have prevented developing country governments from having sufficient domestic revenue to function effectively. And there is a commitment by all governments to try to increase domestic funding, domestic revenue collection from taxes and fees. The challenge is that the challenge for us as advocates is that to the extent that consumers are currently financing the largest portion of the ICPD program of action, we need to be sure that any, if their pocketbooks become emptier due to government revenue, that needs to be offset by increases in direct support for sexual reproductive health services, information, and supplies, and reproductive health supplies. Next slide. I'm getting contradictory messages that I'm both going too fast and too slow. So I'm just going to keep plowing ahead and hope that it's fine. When it comes to advocacy message number 7, The AAAA includes a commitment to achieving gender equality, empowering all women and girls, and realizing their human rights. This advocacy message is to emphasize that women's equality requires access to reproductive health supplies, and that full access to sexual reproductive health rights is essential to promoting gender equality and women's participation in the labor market. These issues are often disconnected, but of course they are fundamentally connected in most people's lives. Next slide. Advocacy message number 8. Governments must fund local civil society to monitor subnational decision-making and impact. The AAAA addresses the fact that within developing countries, there is an increasing decentralization of decision-making around resource allocation to the subnational level. And there has been a commitment made by governments around the world to strengthen local government capacity to manage resources effectively. This is a tremendous opportunity because for reproductive health supplies, because improving subnational government capacity could improve reproductive health supply chain management and access to SRHR. The challenge is that subnational governments often do not prioritize family planning and reproductive health supplies, and they often lack specific thematic knowledge and management capacity. So that's a challenge for civil society, and this advocacy message emphasizes the fact that if local CSOs do not have resources, they are not able to either help, provide technical assistance to, or monitor and hold accountable the decisions that are taking place and the results that are being produced at a subnational level. Next slide. The 9th advocacy message is that better evidence is needed. I mentioned before it's very difficult to know what's going on in development finance and financing as a whole for reproductive health supplies. The data points do not match up and do not create a whole picture that's clear and that we can have great confidence in. The AAAA also has strong rhetorical support for strengthening disaggregated data collection and monitoring for development finance and for monitoring the implementation of the decisions that have been made in the AAAA. The challenge is, of course, that means we need more research. We need more research in SRH. We need more research in for reproductive health supplies. It's one of the least funded categories within the ICPD program of action for the past 20 years. And this advocacy message says governments must fund research to assess the impact of development financing on SRHR and ensure evidence-based decision-making. Next slide. The last advocacy message, number 10, addresses the special needs of middle-income countries. Around the world, most of the people who live in poverty, if I'm correct, live in middle-income countries. And yet, as national per capita income rises, middle-income countries often become ineligible for aid. So this advocacy message is really calling for governments to assess the special challenges and funding needs for impoverished communities and people with special needs in middle-income countries so that the deep inequalities that often exist in middle-income countries are addressed and poverty can be reduced worldwide. Next slide. And now I'm very happy to turn the presentation over to Sibylle Koenig, who will talk about strategies for engagement on these issues.
Thank you, Karen. So I'm going to talk a little bit about the advocacy calendar that we've established under this project as well, and which was aimed at complementing the Financing Demystified guide by providing a timeline of upcoming events in 2015, which can be used as key advocacy entry points and opportunities to help advocates influence decision-making, increase funding, and improve access to reproductive health supplies and SRHR. So this calendar includes events from the end of September for the simple reason that it was meant to be used from end of September, beginning October by the RHSC coalition. And a small table of past events in 2015, so from January until September, was included at the end of the the mapping just for reference and to give a logical background to the study. So the mapping itself includes all the detailed information needed to engage in the most important events during the coming months. Namely, it gives you the entry points, the outcome of the event, how to register, what are the key sessions to attend, which key stakeholders will be speaking or attending, and that you can approach, and some recommendations on actions to take. Next slide, please. Among the listed events in the advocacy calendar, IPPF selected actually 3 upcoming events of particular importance, including some suggested actions. So the first one is one that's actually going on right now. It's the Global Maternal Newborn Health Conference in Mexico City, so from 18th to 21st of October. This conference is, there are about 1,000 people attending. It's organized by the Gates Foundation, USAID, Save the Children, among many other prominent names. It's aimed to discuss strategies for reaching every mother and newborn with high quality health care. So the calendar includes a list of relevant local stakeholders as well in Mexico who could be approached for joint advocacy on reproductive health. Obviously, it's still, it's ongoing right now, but I think the list could be useful just for reference and for acknowledging who is doing some work on these issues in Mexico, for instance. Then the second event that was selected is ICASA, the International Conference on AIDS and STIs in Africa, which will take place on the 29th of November to 4th of December in 2015 in Harare, Zimbabwe. So this is one of the major AIDS conferences taking place biannually, and they have an expected outcome or participation of about 10,000 delegates, so it's quite a major event. Here again, I mean, very simple recommendation is to take any opportunity to form new alliances with the HIV/AIDS community in order to jointly explore implementation possibilities of post-2015 indicators related to HIV and reproductive health. The last key event that I'd like to mention is the COP21. For those of you who don't know what that is, the COP21, it's in 2015, France will be hosting and presiding the 21st session of the Conference of the Parties to the United Nations Framework Convention on Climate Change, otherwise known as Paris 2015. And this will take place on 30th of November to 11th of December in Paris. So this is a crucial conference which needs to result in a new international climate agreement applicable to all countries with the aim of keeping global warming below 2 degrees Celsius. The key messages here would be, or the key actions to take that we recommended to take, was to look at some of the messages we established in our study on how to highlight the importance of reproductive health supplies for sustainable development and for the management of natural resources and climate change. Also, there are a number of youth and gender organizations attending the event, so these could be good allies to have in taking these messages forward. So I'm handing back to Erica now.
Thank you. Next slide, please. I'd like to take the opportunity to overview one specific example of the new funding modality in the changing aid architecture that Karen talked about, and this is the Global Financing Facility. The GFF for Reproductive, Maternal, Newborn, Child and Adolescent Health was announced last year and is currently being rolled out. The GFF will leverage $12 billion in global and domestic resources. The aim of the GFF is to support the global strategy for women and girls, sometimes also called Every Woman, Every Child, and will finance Sustainable Development Goal 3, which focuses on healthy lives. Currently, the donors to the GFF are the World Bank, USAID, Canada, Norway, Japan, and the Bill and Melinda Gates Foundation. The GFF is being led by the World Bank, and the development is being led by a range of different stakeholders, both at global level and at national level. Next slide, please. At the country level, the GFF country approach has moved fairly quickly and has taken really two different approaches. The first step in the development of the GFF at country level is the country level consultation that occurs with government. The second step has been the development of 3 to 5 year country investment frameworks. At the moment, the GFF is being rolled out in 4 front-runner countries, which are the DRC, Ethiopia, Kenya, and Tanzania. And a second tier of countries were announced at the Financing for Development Conference in Addis Ababa, and these are Bangladesh, Cameroon, India, Liberia, Mozambique, Nigeria, Senegal, and Uganda. IPPF and the RHSC have been working closely in partnership with advocates both at the global and national level to coordinate our actions to call for increased funding for reproductive health through the GFF. And specifically, we've been calling on CSOs to engage in the GFF. 1, to ensure the inclusion of reproductive health in these country frameworks, and 2, to ensure accountability and oversight. Next slide, please. So with support from the coalition, IPPF and Advanced Family Planning have produced a fact sheet to capture the lessons learned on the GFF country approach in Kenya and in Tanzania. Again, it is available on IPPF's website, and I do urge you to have a look if you are working on the GFF at country level. If you do work in one of these countries that has been highlighted as a GFF country, we really urge you to get in touch with the Reproductive Health Supplies Coalition GFF workstream, as this has been an invaluable space to exchange information and coordinate as a sector together. In the fact sheet that I mentioned, we have also compiled a list of top tips that CSOs might want to consider in their engagement in the GFF country process. I'm not going to list them all. These are some of the highlights, and you might want to have a look again on our website. But moving forward, it will be critically important for us as CSOs to call for accountability on the implementation and monitoring of GFF country frameworks. Next slide, please. So we do applaud the leadership and ambition of the Global Financing Facility to ensure additional resources for reproductive health supplies, but we do want to highlight just a few concerns that advocates may want to be aware of. The first concern that we have is around the emphasis of the GFF to link grant to loan funding. And this can have a negative implication for countries, as this does not build a sustainable model for financing. We also encourage the GFF to cover the full range of SRHR-related Sustainable Development Goals. So I mentioned that the GFF will fund the SDG 3 Healthy Lives Goal, and we also urge it to cover SDG 5, which is the Gender Equality Goal. And lastly, IPPF recommends that civil society must have a role in the creation and validation of national plans and have a strong role in ensuring accountability. Back to you, Karen.
Okay, sorry, I had to unmute my mic. Just to summarize then, you know, the main takeaway points from this webinar are that development finance is changing in a lot of ways that are likely to affect financing for reproductive health supplies. The Global Financing Facility for RMNCH is a very clear manifestation of this change. The insight and support of the RHSC has been very helpful for helping advocates get a little bit ahead of the game here, or at least to be current with the times in terms of having the best background research that there is available at the moment relevant to these issues for reproductive health supplies and SRHR, clear advocacy messages that can be used, strategies and tactics to engage, and entry points. All of these resources are available to you, and we hope that you can use these to make sure that SRHR and reproductive health supplies are financed in the years ahead. On the next slide, you'll see URLs, websites. Next slide, please. The next slide, please. Thank you. These are web links to many of these studies, the Addis Ababa Action Agenda itself and the Civil Society Declaration associated if you want to see those. The extensive RHSC study that was completed in April with the annotated bibliography of 157 studies that were reviewed. The IPPF Key Advocacy Messages and Financing Demystified report, which is a much more user-friendly version of the RHSC study. The GFF country consultations fact sheet and advocacy mapping. All of those can be accessed at these sites. Thank you, and I guess we're happy to take questions now.
Good. Well, thank you, Karen. I think the way the questions are going to work is people have been asked to enter questions directly into the webinar, which I think Emily is going to be managing. I don't know, Emily, if you have any questions that have appeared during the course of the discussion.
At this point, we had a suggestion from Maria Bordello on adding another event on the list of events. So there's financing for development follow-up that will take place 28th and 30th of October as per the draft program of work on the second committee of the 7th session of the UNGA. So I think that's an important one to add to the list. And then we got one question on the role of local consultants in these countries, which I think, if I'm right, is referring to the GFF countries. So Erica, I don't know if you can give some clarification on that question.
The only information that I do have on the use of local consultants in the GFF has been around in some countries on the GFF country consultation. We understand that local consultants have been hired by the World Bank to undertake the country level consultation. And in our fact sheet, we do encourage advocates to actually look through their network of experts that are in reproductive, maternal, newborn, and child health as potentially being one of the consultants that may be appointed by the World Bank. That's the only information I have on this point about the use of local consultants. I don't know if Karen or Sibylle have come across anything else in their research.
For my part, no, I haven't. I don't know if what the specific question was, but
not from my side either.
Sorry, Sibylle?
Not from my side either.
Okay, I got another question. Yeah, another question from John Townsend on the mechanisms for accountability that appear the most effective within the GFF context.
So I guess
I don't know if this is specifically on. Yeah, can you tackle that, Erica? Or
well, I can just mention some of the work that we've been doing, the work that we've been starting around accountability on the GFF, and then maybe Karen, if you wanted to answer more generally. I wanted to point out that the RHSC Advocacy and Accountability Working Group has put together a sign-on letter for advocates to urge the World Bank to ensure that there are accountability mechanisms not only at the global level but at the national level in country platforms. I do know that there are plans to ensure that civil society is included in the accountability mechanisms, but from our perspective we have to make sure that that this is a participatory role that civil society can play in accountability and not just tokenistic. Karen and Sibylle, did you come across anything on exemplary models of accountability in your research?
I would simply point to, I mean, there's a constantly evolving sort of literature base and evidence basis on effective advocacy and accountability practices. I know the Evidence Project has looked quite a bit at those, and I think, John, you're probably familiar with some of those, although I've lost track a little bit where they are on that. Social accountability mechanisms that take place at the local level have been receiving quite a bit of attention on that. As these projects haven't focused on the specific mechanisms for accountability yet, I would just provide advice that in my much too long experience, when it comes to any advocacy and accountability, you have to really focus in on who is the real decision maker and what is the best way to influence them for what you're trying to achieve. It often requires thinking outside the box and working outside your comfort zone, not just going to your allies and the people you feel comfortable with, but going directly to the folks who have the most power and finding the people around them who have influence on them to help them understand the importance of SRHR and reproductive health supplies.
Yeah, and just to add to that, I mean, I hope the advocacy mapping we've established will actually help in doing that. I mean, help looking beyond outside and finding people you may have not approached before, but that you could take, take on an approach for taking these messages forward. So, yeah, just to add that.
Okay, next question. We got a remark from Sanjita Raja, who says that the precaution of use of loans is a bit overblown because the loans are spread over 25 to 38 years with a grace period of 5 to 10 years and with interest rates that are only 0.75%. So the benefit is too high in the future, and she's convinced that we shouldn't be so shy of using debt loans. Karen, I think that's a question.
Yeah, sure. I'm happy to address that. It's a good point. There's certainly more sophisticated analysis relevant to each specific loan is entirely appropriate. In a related piece of research that Sibylle and I are working on, we found that among many of the European donor countries, there's actually been a dramatic increase in commercial rate loans. And I think what you're talking about, I'm sorry I didn't catch your name, but I think what you're talking about is concessional rate loans. And so the first question is it a commercial rate loan or is it a concessional rate loan? And then the second question is, what does that pertain to? The challenge in the context of this research is that the information around the loans is not super transparent. It tends to be a bit haphazard in terms of being able to find out on what criteria the decision was made to give a loan rather than a grant, and what specifically is contained and what are the terms of the loan. That information is difficult for most of civil society to be able to access. When this issue has been addressed specifically with the World Bank in the context of the Global Financing Facility, they've said, well, go to our website. And it's quite a large website, and it's actually not so easy to just go to their website and find information. I know that there are others who've worked more closely with the World Bank to get more information about those loans, and often there are frustrations around that as well. So I would just say maybe the point is mildly exaggerated, but I would emphasize mildly, because if the information is not readily available, how the decisions are being made around the loans, and whether or not there's been an independent assessment of the relative cost effectiveness, that is, total costs related to impact of the loan as a financing mechanism, I don't think it's significantly overstated.
May I add something, Karen?
Mm-hmm.
Yep. So I think in our studies also came across that there are certain principles already established by the UN on sovereign lending. So I think as a minimum as well, these principles should be respected. And they include also some of what Karen just mentioned, you know, and also looking at the capacity of the countries to manage those loans. This is probably a kind of minimum standard to take on. On the other hand, there's also like a lot of openness on the side of certain donors, for instance, major donors like the EU, to listen to civil society and their concerns about, you know, new facilities like blending, even though that's probably looking at concessional loans, but also to listen about, to the concerns and to improve these mechanisms. So this is also worth highlighting, I think.
Okay, now we have one last question from Sangeeta Raja again. She questioned the fact that in the GFF, the budget, it sounds a lot of money, but in fact it's not enough. It will not be enough to finance the full ICPD agenda. So we as an SRHR community will need to narrow down on our focus on what we want to see financed exactly. So what will be our focus there, and do we need to focus on that, or do we need to keep advocating for a broader budget? Erica?
Thank you very much for that statement. I couldn't agree more. It's a very small amount of money. If you look at how many countries are involved, it is very little money. It has the potential of course, having more donors on board and potentially being a larger pot of money. In our experience, we have been particularly advocating for a more broader range approach to reproductive health, for that to be included in the country investment frameworks. And to be completely honest, we are having a real difficulty in making sure that reproductive health is included in the country investment framework. I would urge advocates at country level, if you know your contacts better than we do, if there is something specific within reproductive health that you believe should be costed, then to definitely make that ask. But we as a community are having challenges just to even have the inclusion of reproductive health at the moment.
Okay, thank you. We're done with the questions, so I'd like to give the word back to John Skibiak to close this seminar.
Thank you. Thank you, Emily. And I'd like to thank everyone for having joined the webinar, and in particular to Karen, to Erica, to Sibylle for really some fascinating points and discussions. Obviously, in a webinar of an hour, there's not a lot of time to go into great depth, so I really would encourage everyone to read both of the pieces of work, both the study that was done and also the demystifying financing piece published through IPPF. There is a web page on the Coalition's website under activities and resources devoted to the GFF, so I encourage everyone to look at that. That's where a lot of the materials are posted that we've been talking about today. So I think that really brings us to a close, and I'd just like to again thank those who spoke, those who contributed questions, and those who joined in. So thanks very much.